And if you have a question, you can raise your hand, you can unmute, you can type it into the chat, and I'll answer that. But what I always start with when I do these reviews, especially for your semester, is that I want to make sure that I cover the things that are new. And the thing that's new for you guys this semester is the heparin protocol. Because you've seen flow rates, you've done the the parenteral medications, the oral medications, you've done all those things already. So what's new is, like I said, the um uh heparin protocol. So we'll go ahead and move down to that. So in your review, I actually have several heparin protocol questions to practice. So if you've already done them, or if there's some that because I didn't create a key for this directly, because most of these you should be able to solve without or with little issue. But I figured if you do have any questions, I know that you'll stop me and say, "Hey, can you help me out with that?" Um, so um, there's a couple flow rate questions to review, but what's new is this is a new type of question that you haven't necessarily seen before, where you have basically units per hour, and they're asking you to convert it to milliliters per hour, and then they're going to give you an IV, and you need to know that you got to use the information from the IV to convert units per hour to milliliters per hour, or in the reverse, milliliters per hour to units per hour. So I'm going to do the second variation of this, and I'll actually do these two kind of on top of each other just to kind of show you those. And then that way you have those answers. Because those are, like I said, the newer ones. Some of the older ones, you'll find the key in the archive folder from like previous reviews, or your review packet may already have the key to most of these as well. I'm gonna be honest with you, I don't know what's in your review packet. I haven't seen it. Um, the only review packet that I've seen more recently is the 240 review packet. So, but saying all that, let's take a look here at this question. So what this question is asking is it's asking you to go from units per hour and convert it to ml per hour. So it's just it's a conversion question. So if you're used to doing like ordered over available, desired over have, that sort of type of formulation, these are going to be different. They're a little bit more challenging if that's kind of where you're focused, because you really aren't doing anything with an order or an available. You are, but it has more to do with the flow rate than it has to do with like just finding one particular unit. So the way I'm going to show you is the way that I find in my mind is more direct and simplified. But if you have a different way of doing it and you're getting the correct answer every time you do it, then keep doing it. Don't change because of what I show you. So if I'm solving this question, I want to first pay attention to what I have here. So I have 250 ml in 20 or 25,000 units. Are these two are connected? They're in the same, IV bag. So you got this bag of IV, and they're both things are in there, right? So the medication is in with the normal saline. I've had this asked, but like the 0.45%, that's just telling you what the concentration of the normal saline is. That is going to have no variation on your calculation. Okay. So you just need to know the mLs and the units, and then you're good to go. The other thing is it gives us our 2,500 units per hour. So that's actually what I'm going to start with. So I'm going to write out my 2,500 units per hour. And what I want to do is I want to see if I can convert units per hour to milliliters per hour. And I think I can. And what's going to allow me to do that is I need to get rid of units, okay, and then convert it to milliliters. So if I can find a conversion factor to do that, or look at my available, then I should be able to do that. So what's my available? My available is this 250 ml IV with heparin in it. So all I'm going to do is I'm going to take those numbers, 25,000 units, put it with the units, and then 250 ml. And then I'm going to um, calculate it. So I'm going to take 2,500 times 250 divided by 25,000, and I should get 25 milliliters per hour. Give me 1 second. All right, I forgot I put my phone slash calculator um, in the other room, and so I just wanted to grab that real quick. So that's how you would solve this. All we're doing, like I said, is converting units per hour to ml per hour. So you might see an insulin infusion question like that, or a heparin infusion question like that, like we just did. You might also see an insulin infusion question. So it's basically the same thing. It's just that it's a different medication. Okay. So for this one, we're going to do the same thing. We're converting units per hour to milliliters per hour. So I'm going to follow the same procedure. This one tells us we have 250 ml, and then it tells us we have 10 units. We don't care about this concentration of the saline. We don't care about the concentration of the insulin. We just care about the quantity of measure, or what we would refer to as the available concentration of our IV. 250 milliliters, and then how much insulin is in there? 10 units. Okay. It tells us that it's infusing at 2 units per hour. So that's the information we want to use when we're trying to calculate the flow rate for this particular type of question. So I'm going to take my 2 units per hour. So I'm going to just do the exact same setup I did previously. You already know that we're looking to get rid of units and convert it to milliliters. And the only thing that's stated here that contains milliliters and units is our IV. So 250 ml and 10 units. And then we're going to take 2 times 250, which is 500, divided by 10, which will give me 50 mil per hour. So sometimes when you're doing these questions, especially when we do the heparin protocol, it's going to say something like calculate the IV drip rate, and you might be thinking, okay, drip rate means I'm dealing with drops and drop rate and things like that, but that's not what they're looking for. Drip rate is just telling you that because if you think about it, 50 milliliters, that's like 2 tablespoons, right? 2 tablespoons is 30 milliliters. So let's just say 3 tablespoons, okay? So 45 milliliters. So 3 tablespoons being infused over an hour is going to be coming out quite slowly. It's going to be dripping out, okay? So insulin is getting dripped out at 50 mil per hour. Heparin is getting dripped out at 25 mil per hour. So it's coming out very, very slowly. So when they use that word drip rate, don't get confused thinking like, where's the drop factor? If they're looking for drop rate, they're going to give you a drop factor to calculate. Okay. All right. So let's let's take a look at a heparin protocol, because those are, like I said, the other new thing that can be a little bit overwhelming. So I went through this protocol here on Tuesday. And this is unfortunately probably what you're going to see on your test. And the reason I say unfortunately is because I made the mistake when I introduced this question to the test, not just so you know, it wasn't by choice. It was just they said we need a heparin protocol question, and I didn't know exactly what they meant. And so I basically wrote down or I just copied and pasted the entire protocol and then included that as part of the test question. That's not, I'll show you the cleaner version of this, but right now this is what you might see on your test. And what I mean by that is if you type in, like, do an online search, a Google search or whatever for heparin, protocol, you're going to see this step by step protocol listed there. So it'll have like 15 steps, and it just tells you like basically the sequencing to how to treat these patients. Now, some of the steps are going to be important for doing the math that we're doing here with the dosage calculation. Some of it, though, unfortunately, is going to be useless because it has nothing to do with the math that we're calculating. And so what I did, and you unfortunately will not see it like this on your test, is I highlighted what's important and I crossed out what's not important. Okay. So um, just keep that in mind that and get used to seeing this. And then when you practice this, or if you have it in your lab packet, it should say, it should show this without the highlights and things like that. I left the highlights in there because these are the areas I want you to focus on. So basically, the weight-based heparin protocol is asking you to do a couple of things. It wants you to be able to practice converting pounds to kilograms, and it wants you to be able to calculate a bolus dose in milliliters and an infusion rate in milliliters per hour. Okay. So when you do this question on the test, you're basically going to be answering two questions within the one question. Question one, calculate the bolus in milliliters. Question two, calculate the infusion rate in milliliters per hour. So we're going to walk through that. Um, So when you see this protocol, you're going to see a lot of things repeated. So like it'll tell you to bolus the patient with heparin, 80 units per kilogram body weight. It'll say to start a drip at 18 units per kilogram per hour. You're going to see that same information repeated later on down in the protocol. It's actually listed here in step 10 of the protocol, where it says bolus. Sorry, I meant to just highlight here. Bolus with 80 units kilograms, start a drip at 18 units. That just tells you what you're starting. So when you initiate the heparin protocol, this is what you're working off of. This is also why you know you need to account for the patient's weight in this type of medication because, or in this type of procedure, because it tells you that the weight or the order is in units per kilogram. So we have to account for the patient's weight. You're going to also address this a little bit more this semester when you do the pediatric part of your 220, 230. In pediatrics, you have to do a lot of weight-based calculations because they're going to fit within a range. And then you're going to have a separate, dosage calc for pediatrics, and you'll have like a review sheet and you'll have a test to do for that. It's not the same. You're not going to see that same information on this test or even in the fourth semester test, but just to let you know that you're going to learn some more nuanced dosage calculations. And if you want a preview of that, I have on my YouTube channel, I have a playlist for the pediatric dosage calculations, and you can kind of see what those are and how they're solved and how they're worked through. The other thing is step 2 of the protocol actually gives you your available medications or what you have available. So the first thing that's available is this heparin 200 or 25,000 units in 250 milliliter half normal saline, okay? Which just means that you have an IV attached to your patient, and this is what you're going to base your infusion rate off of, okay? So what we're programming into the infusion pump, that's what we're using in order to calculate our infusion rate, and I'll show you how that's done. And then finally, we'll have a bolus dose strength of 1,000 units per milliliter. So you have two things. One's a bolus, and I always say just imagine there's like a separate vial that you're pulling from. You're going to draw out the amount you need from that bolus dose, and then you're going to add it to the patient's IV via a port, as opposed to the using the IV solution to bolus dose. The bolus is more concentrated. The IV is less concentrated, so you would actually require a lot more volume of the IV if you were going to try and bolus dose that. And it sounds to me that that's not the right route to bolus somebody with. All right, so we'll get to steps 11 through 15 in just a moment, but I just want to kind of walk through some of these things and how we kind of use this information when you see it. And like I said, we'll practice some of the ones that are like cleaner in the examples below. So the first thing is you have to convert the patient's weight in pounds to kilograms. I already did that for you. So 156 pounds divided by 2.2, and we're going to get 70.9 kilograms. Okay. I know instinctively you want to round that up to 71, but just following CCAC rounding rules, round, you round to the nearest tenth, especially if you're like kind of chopping up the thing. If you want to wait and do your calculation at the end and you're rounding at the end, that should be fine. Um, you can do that way as well, but I typically do it chopped up just so you can kind of see what it looks like as we're moving through and where some of these numbers are coming from, especially those who don't care for dimensional analysis. So in the first example, we're going to take the patient's weight and we're going to find out what the bolus amount is. So we're going to take the patient's weight, 70.9, okay, multiply by 80. And why we're multiplying by 80 is because we're looking for the bolus dose, and the bolus dose is 80 units per kilogram. So 70.9 times 80, and we get 5,672 units. If this question said calculate the number of units to administer for the bolus, you'd be done, but they don't ask that. They're actually asking how many milliliters. So you have to convert units to milliliters. Not a big deal. All we do is we find a conversion in order to eliminate units, which we did here. And then I'll also cross out. So we got rid of units, and then we're left with milliliters when we do this particular problem. Where do we get that 1,000 units per milliliter? That was from what we have available. Remember, the available was the bolus dose strength of 1,000 units. Okay. Then we get 5.672, round to the nearest tenth. So our final answer for the bolus dose would be 5.7 ml. I'm going to do a similar process for the infusion rate, but instead of using 80 units per kilogram, which is what the bolus order was, we're going to use this 18 units per kilogram per hour. So if I look here, it tells me start a drip at 18 units per kilogram per hour. That's where I'm getting that information from. So the protocol is kind of like this giant label or poster, and it's just telling you all the information you need in order to follow, in order to answer the question. That's going to be listed down below. So you're going to take the patient's weight, 70.9, times 18 units per kilogram per hour. Kilograms cross out. And then we're going to be in units per hour. So 1,276.2 units per hour. We're going to then convert units per hour to milliliters per hour. And this time we're not going to use the bolus dose because we're not calculating a bolus. We're going to use what the IV says. So the IV said we had 25,000 units of heparin in 250 milliliter half normal saline. So that's where those numbers are coming from. Okay. We do that math, we get this answer, we round it to the nearest tenth, and we get an answer of 12.8 ml per hour. So on your test, and if you weren't here Tuesday, I said this, you're going to get this heparin protocol, and it's going to ask you two questions. Okay, it's going to say calculate the bolus and calculate the infusion rate. Those two questions will satisfy the one question. So meaning like if you miss one or both of these questions, you've only missed one question. Okay. So you don't miss two if you miss two. So it's still 25 questions. What I'm showing you right now is one question. Now, for practice purposes, I added these other components here. Basically, what this says is after the patient's been on the heparin protocol for a period of time, so 6 hours, they reassess. They look at the APTT and they look to see is he uh, are they clotting prematurely? Are they are they good? Like how are they responding to the heparin protocol? And so if you need to do this, which I don't think so. I don't know that I've even seen anyone have this as a question, but just in case you do, if they give you this and you have the whole protocol to look at, this is where you use those additional steps. So like you see here, it says APTT of 43 seconds. Okay. So when I go up to the protocol, this this is where that applies. So it says if the APTT is, and then you just look for the range that falls into. So since it's 43 seconds, we're going to use the step 12 of the protocol. And what does step 12 tell us to do? It tells us to rebolus with 40 units per kilogram and increase the rate by 2. So the trick here really is just knowing that you're going to use a different bolus number, 40, okay, which is half of the original, and you're going to increase the original rate by 2. So if the original rate was 18, what are we going to increase it to? We're going to increase it to 20, okay? And so I worked that out, and you can watch me work that through again if you need to on the YouTube replay from Tuesday's review. The reason I'm kind of just gonna I'm not gonna work through that or talk through it again is because I don't think you're gonna see that question. It was more so just a practice question. And so what I wanted to do today was do some of these additional um, heparin questions just for additional practice, just in case you need to see it. So when I said the whole protocol is listed there, I created some just kind of shorthand heparin questions that you can practice. And basically, I got rid of all the tables and all the numbers, and I just put in the important information: the bolus dosage strength, the available IV, and then what the orders are, and then you can practice those. So what I want to do is I'm going to go down to one of these that I haven't done yet. So we're going to do this 132-pound patient, and we're going to work through it. So I'm going to give myself some space here, and we're going to work through it. So before we get started, couple things. When you're dealing with the heparin protocol, you'll know because it'll say these heparin things in units per kilogram body weight, and it'll ask you two questions. Calculate the milliliters to administer for the bolus, and then it'll also ask you to calculate the infusion rate in ml per hour for the heparin. Okay, so your infusion rate in milliliters per hour, and then your milliliters of the bolus. So that's your clue if you see it worded this way, that you're doing a heparin protocol. Okay, so step one is always going to be convert pounds to kilograms. Okay, you got to take care of that first. Then once you have your weight in kilograms, you're going to multiply by 80 for the bolus. You're going to multiply by 18 for the infusion rate. Then once you get to your units, that's where you're going to use your available to convert units per hour to milliliters per hour or units to milliliters. So let's go ahead and work through this. I just want to highlight the things so I don't so I'm not drawing all over everything. All right, so step one is I'm just going to write this here. I have a 132-pound patient. All I'm going to do is take 132, divide by 2.2, and I'm going to get a kilogram of a nice even number of 60 kilograms. Okay, so you don't have to worry about rounding with this one, which is nice. So I'm going to take my 60 kilograms, and I'm going to multiply by my 80 units per kilogram. Get rid of kilograms. 60 times 80 is 4,800 units. Now, again, if it's asking for milliliters, we have to have a way to convert units to milliliters. And since we're calculating the bolus, that's how I know what available to use when they give me two availables. So I'm going to calculate using the bolus dose strength of 1,000 units per milliliter. And then what I'm going to get is an answer of 4.8 milliliters. So my initial bolus will be 4.8 milliliters for a 60 kilogram patient. For the infusion rate, 60 kilograms times now 18 units kilogram hour. Eighteen again is coming from, it says to start a drip, so I'm just following what it says to do. So 60 times 18 gives me 1080. Wait, I hit the wrong button. 60 times 18. No, that's right. Okay. So 1080 units per hour. And we don't want units per hour. This is where, when I reviewed the heparin infusion and then the insulin infusion, this is why I was doing that first, is because it's good practice before you even get to this. You've already done this. You've already gone units per hour to milliliters per hour. You've done this before. You know that we want units here because they'll cancel out, and we want ml here. The only thing you may not be 100% confident with is, well, what units ml, like what do I put for my numbers? Well, if we're talking about the infusion rate, that's the IV. We're going to use the IV information. We're not going to use the bolus information. We're going to use the IV information. The IV information says 25,000 units and 250 ml. And then what we're going to get is an answer of 10.8 milliliters per hour. So again, if you've seen this a couple of times now, hopefully it's starting to like click, at least the flow of it. If you have an easier way to do this and you're getting the right answers, great. Like when I do these problems, in my mind, I just sit there and I go, okay, if I'm following just the standard weight-based protocol, the only thing I'm going to do is I'm going to take the patient's weight in pounds, divide by 2.2. And if I'm calculating a bolus, multiply by 80, divide by 1,000. And then that's my answer. If I'm doing the initial infusion rate, again, patient's weight in pounds divided by 2.2 to get it to kilograms times 18 divided by 100. And the only reason I'm telling you that is because I know from experience and even just writing it out, 250 over 25,000 is the same thing as 1 over 100. I do not recommend memorizing that. I recommend writing it out like I'm showing you and plugging it into your calculator. So make sure you're doing everything correct. Someone on, I can't remember if it was a Boyce student or an Allegheny student, but had asked, is there alternatives? Like, would you bolus the patient with a different number? Would you have different availables? And the answer is, yeah, you could. So you always want to pay attention to what they have written there as what is your available and what is your order. Meaning, like, if we go down here, so this is like part two of the question where it tells you to do something. It tells you to rebolus with 40 units per kilogram. Okay, so that's not a big deal. It's just telling you to rebolus with 40 units per kilogram. But then it tells you to increase the rate by 2 units per kilogram per hour. So now we're going to be changing up what we did in the initial problem here. We're changing the bolus information and we're changing the um, infusion information. So we're going to, whoops, we're going to do that. All right. So I'll walk through this too. Again, these are just extra questions. So you may see a question where it says, the original order was, and then after 6 hours, the APTT is this, and so the new order is to rebolus at 40 and then to increase the rate. You have to know what the original rate was in order to calculate the new rate. So that will be given to you. So they'll like the only other way that maybe this question might be asked is like if the original infusion was 16 units or 18 units per kilogram per hour, and now you have to increase it by 2, you'll know what it is. You don't have to guess about that. Okay, it would be given to you. Okay, but since we know, because we know the original was 80 and 18, so we know that the new one would be based off of 20 units per kilogram per hour instead of 18. So just for again for practice, we'll take and do this. So to keep it simple, 40 units per kilogram is exactly half of 80 units per kilogram. Okay. So we could actually just cut this number in half and it's going to be 2.4 milliliters. So if you did that, great. If you don't feel comfortable with it, or this is a problem where you didn't calculate the original 80 units, then what we're going to do is the same thing we did in the previous setup, 60 kilograms times 40 units per kilogram. And we get 2,400 units. And then we're going to use the bolus dose strength to convert units to milliliters. So 1,000 units per milliliter, and we get an answer of 2.4 milliliters. Okay. For the infusion rate, this is the only thing we have to do something a little bit different than what we did in the original because it doesn't give us a direct number. It says to increase the rate by 2 units per hour. So you need 2 units per kilogram per hour. So you need to know that your original was 80 or 18, I'm sorry. And so we're increasing it to 18 plus 2 to 20. And then now we just do our calculations here. So 60 times 20 is 1,200 units per hour. And then we're going to convert units per hour to milliliters per hour. And we're just going to use the IV in order to do that. 25,000 units, 250 ml. That's going to give me an answer of 12 ml per hour. So what I've recommended over the years or semesters of teaching this is to practice using different patient weights. So you can use your weight, you can use a friend's weight, parent's weight, significant other's weight, just use someone else's weight. Um, so good, that's a good question. So someone asked, or Elena asked, heparin protocols can vary between hospitals depending on the policies they have. I don't know the answer to that. My guess is that, like I said, if you do a Google search, the numbers I'm using were like that's what showed up for the standard heparin based protocol. So I don't know. I doubt that they would use different protocols at different hospitals unless there was a reason for that. So I don't know the answer to that. I guess you'll find out if you work in this particular type of field or work with, a particular group that uses a different protocol or a different hospital that uses a different protocol. So I don't know the answer to that. When I was telling you about the different like variables that they can use, I'm just saying just to pay attention because in a math test, we can change up the variables all that we want. I tried to keep them consistent, but I know at Boyce campus, I've seen some example problems where they did use different numbers and different values. And so that's what I wanted to make sure you were at least familiar with the fact that they could use different numbers. I doubt that they will. Um, but no matter what, you're going to know what the original was or what the previous was. So like let's say now this patient's on a 20 unit per kilogram per hour and then they do start to respond really well. And so maybe we want to bring the infusion rate we want to titrate that down. So it might tell you to drop it 3 units per kilogram per hour, so decrease the rate by three. So now you're going to go from 20 to 17, right? And then 6 hours later, they're not responding. So we want to increase it by four. And so, like, you can get a variation of numbers depending on where someone is in a protocol. Because if you saw in the big protocol where it tells you a couple things, it says here that you're going to check the APTT every 6 hours daily for two consecutive APTT. So you're constantly reevaluating that because you're probably going to have to either take them off or on the heparin protocol. It's not something they're on indefinitely. They might be put on some other like anticoagulant like a Coumadin or warfarin or something along those lines, but they're not going to be on. Hopefully, they're not going to be on heparin for a long period of time. I don't know what the time frame would be, but I imagine just the duration of their hospital stay after a particular you know rehab or whatever they're there for. You're welcome. Sorry, I know that was a long-winded answer for your question. All right, so those are the main things that you're going to see differently. If you had a chance and you want to ask any specific questions or a particular type of question, just like I said, just type it into the chat. I have like 13 minutes scheduled for you guys remaining. So if you have any other questions, just let me know. If you feel pretty good and strong, then you don't have to stick around. And then I'll just say good luck on your test. But if you do, I'll be here.
I'm not sure what you did on Tuesday because I didn't log in on Tuesday. Is it different from what you're teaching us now?
So I mean, no, if you saw how I wrote out some of these things already, so they were done on Tuesday. So if you go to the YouTube channel, you can watch the Tuesday review. Um,
Okay.
okay, so two questions that are really good. Do I have any other practice tests? So all of my practice and review material is on the OneDrive folder. So I updated this for this semester. I gave a PDF of a blank version of what I'm showing you now. So it's in the OneDrive share folder, and then there's an archive folder. And if you go in the archive folder, you can see some of the older reviews. Excuse me. So if you want to look at those, that would be the place where I have. So I don't have any other information beyond that. So I don't have any other practice sets other than what's listed on there. You can look at Boyce's 220, 230 review. That's something they do ask questions just a little bit differently, but you can challenge yourself by going through some of those. Um, and then obviously your packet, your review packet. Um, Okay, so good question. So someone asked about, oh, hold on one second, practice tests. Yeah. So yeah, the practice tests, like I said, are on the OneDrive folder. Um, all right. Yeah, y'all, I only have the one that is listed on in here. Yeah, the archive folder is in the same folder. So if you go, when you click on that link, for the OneDrive shared folder, you click on Allegheny 220, 230, and then in that folder, you'll see a subfolder called Archive, and then you'll be able to find all the old stuff there. And then I put the newer things that I've created, which are probably similar to what your packet is, and what I'm showing you now. And then I'll also post this as a PDF key, so you can see it. Obviously, it's not all answered, but you'll see the ones that are newer and challenging. All right, so for rounding rules, should we be rounding to the tenths place for every question unless specified? So you don't round when you do metric to metric conversions, right? So if I'm converting 125 micrograms to milligrams and I get an answer of 0.125, that's your answer. Do not round that. If I'm going from 125 pounds to kilograms, you do round your answer to the nearest tenth. So a number greater than one gets rounded to the nearest tenth. A number less than one gets rounded to the nearest hundredth. When you are dealing with drop rates, right? Remember you did drop rates last semester. So you can't give someone a partial drop. Okay. You have to give them a whole drop. So if it's 20.2 drops per minute, it's 20 drops per minute. You can't give them a partial drop. If it's 20.5 drops per minute, you round that up to 21. And so that's how you would handle rounding. Good questions, by the way. You're welcome. Any other questions or concerns? Now, those of you that might be getting frustrated with the not having more like practice tests to practice from, what I always tell students to do, and this is how I would handle this, is work through the process. The only thing that's really going to change is the numbers that are being given to you. Like I mentioned to you about the heparin protocol. You're most likely going to see the same available, the same order. The only thing that's going to be different is how much the patient weighs. Okay. And so just practice using different numbers. And if you want to verify your answer, you can always let me know and I'll give you feedback on that. Um, but it's more about working through the process and getting the habit of where you put the things if you're following dimensional analysis or where you're or at least that you're getting consistent answers. So don't work through math just to get the answer. Work through math, the dosage calc math, to understand the process getting to that answer. Because like I said, the process is what's important. That's what tells you how to get to the answer, not just memorizing the answer. And I think you know that, but that's how I would handle that if I, like you, only have access to limited things. And you don't necessarily want to go out and look for a bunch of different example questions because they may not be applicable to what you're doing. Like if you're looking for half-life medications or calculating the square square inches of a topical or square centimeters of a topical. Those are just not things that you're going to necessarily see on your dosage calc test, so you'd be wasting your time doing that. So when I created these reviews, they're very specific to what's in your blueprint. All right. Well, great questions all around. Like I said, if you don't have any other questions, I'll just tell you good luck on your test. And if you do have any other questions, feel free to email me. I'll be sticking around here for the next few minutes, but if you're done, good luck to you, and I hope you have a great semester.
Thank you.
You're welcome. Thanks for coming.
Excuse me.
Yeah.
S- the archive you're talking about, is it when I go to the YouTube?
Uh, for what do you mean? Like to
Just
watch the
the
review?
no, the question, the ones you did already.
Hmm.
Somebody was asking where is the archive folder? Is it when I go to the YouTube I'll be able to find it?
No, no, no. So in the email that your instructor sent you that where you got the link for Zoom, underneath
Yeah.
it, it says there's a shared OneDrive folder. So you click on that link to get to the shared OneDrive folder. And then underneath that was the link to my YouTube channel. So the
Oh, but
shared
what
OneDrive
what
folder
I have
is only for CCAC students.
what I have here is the Zoom link, the resources, YouTube,
Yep.
and your
The resources is what you're looking for.
okay, so that resource is the one they write is the YouTube. It says www.youtube.com at something at the tutor,
Yeah, the
right?
Rad Tutor. So there should be another link there for it should say something like Microsoft 1 point share folder.
Um, I didn't see that one. Is it before the link? Because I'm
It should be listed before the YouTube channel.
I'm going let me show you just one second since I have 5 more minutes. Let me go back and